Well, hello and welcome to the 27th Degree with Chris and Nancy. We're taking a little break from the studio this month. I'd like to thank Baycoast Bank, which is just right. For all of your financial needs, visit baycoast.bank or call 508-678-7641 to learn more. In Duncan Hearing Healthcare, visit Hearing Healthcare You Can Trust with sites in Fall River, Dartmouth, Falmouth, in Centerville. For more information, visit their website, duncanhearing.com. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform and by following us on Facebook and Instagram. Also, please remember to leave a review. So let's get right into it.
So for the end of the summer, we decided to do Ask Your Doc series, something kind of fun with some questions that I think a lot of people will want the answers to. So this is dedicated to screening. So colonoscopies, mammograms, pap smears, bone density tests, anything else you can think of.
Sure.
Why don't you talk about the importance of each one of those, why we do them, and what age we're looking at.
So as a caveat, I will say, although there are standards on what we recommend, there might be subtle differences between provider to provider. Certainly talk to your provider about what they recommend. But this is pretty much what most people do. Colonoscopy. So it used to be 50. Now it's 45. We're recommending colonoscopy. And the reason for that is it was realized that there were younger and younger people developing colon cancer. Colon cancer is one of the more common causes of cancer death. We think about breast cancer, which is important, of course, and lung, which is important, and prostate, which is important. But colon cancer, for some reason, gets overlooked. And I think it's partly because no one wants to get a colonoscopy.
Right.
But I'll tell you, it's a completely benign procedure. I've had a couple myself because of family history. And, you go into the center and you take a prep before that cleans you out. They give you some medication to sedate you. You're really not aware of what's going on, and the procedure's over in a very short period of time. You wake up, you feel fine, and you go home and you have a good meal, and that's it. And then you're good for 10 years if nothing is found. If there's a family history, it's every 5 years. If there's polyps found, and polyps are precursors to cancer, it can be 5 years for a repeat, or 3, or even sooner, depending on how many and what's found. But what we're looking for here, we're hoping not to find colon cancer.
Right.
We want to find polyps. Certain types of polyps will progress to cancer, and if we take them out, and we can do that right during the procedure, you can really save lives. Now, we did an earlier podcast where we walked through the endoscopy center at Primary
that was
Care.
great.
We talked about a lot of this, and I would recommend, if you're really interested in this, go back and look at that. But 45 is the age now, and insurances are covering that. I haven't had too many that haven't. And it's probably going to go down to 40 in the next, year or two.
Right.
So right now it's 45. It was 50. And once again, if you get one done, then you're done for 10 years. There are some other ways to screen for colon cancer. Cologuard is one. There's FIT testing, which basically is looking for blood in the stool. But, the gold standard is really still colonoscopy. The other tests are good, and it's good for someone who can't have a colonoscopy for whatever reason or doesn't want to. But I would always recommend colonoscopy as the gold standard.
And like Chris just said, please watch that video with Dr. Maddock that we did. We actually toured the whole colonoscopy suite, which is beautiful at Primary Care. They have a really nice suite, but we explain everything, and I think it's interesting to see kind of a behind the scenes look, but it's really great now.
Yeah, it's really a painless procedure. It's not as bad as what many people think it is, and even if you had a bad experience in the past, because the sedation that was used previously is different now.
Yeah.
Most patients aren't even aware that it's
very gentle.
So try it again. It's going to be a different experience.
All right, on to mammograms.
So mammograms, I generally recommend these at 40. That's what I think a lot of people are doing. I'm still recommending yearly mammograms. I know that there's been some other thought that, well, maybe you don't need to do it every year. Maybe it's every 2 years in certain populations. But
it's confusing.
If I look at the data and I really think about it, it makes sense to do it yearly. I mean, breast cancer can be devastating, and 2 years is a really long time.
Yeah.
A lot can happen. So when do you stop doing them? Well, that's an interesting topic too. A lot of women will say to me, well, I'm 80 years old, I don't need to have a mammogram. But older women are at risk for breast cancer. And unless your health is such that you're really limited, you're bed bound and you have a terrible quality of life, if you're up and about and enjoying your life, you should continue to have mammograms.
Right.
If you say to me that, you know what, even if I knew I had breast cancer, I wouldn't do anything about it. Okay, don't have a mammogram. But if you're not in that category, then I would still recommend you get it. And I'm still recommending every year, and a lot of doctors are, and there are some who are recommending every 2 years or whatever. But a lot of those recommendations are based on data that is looking at societal burden, financial burden, issues like that. When I sit in a room with a patient, I'm looking at an individual, not a society. So, I don't want to wait,
right.
18 months to get a mammogram and find out, oh, I would have known they had breast cancer 6 months ago.
Right.
Or wait 2 years and I would have known they had it a year ago.
And time is so...
Right, and time is critical. So that's how I'm looking at it, and I think to me, that makes the most sense.
Who orders the mammograms? Is it the primary care physicians or the GYN?
It can
people?
Be either. It can be primary, it can be GYN. It doesn't matter. In my annuals, I go over all this stuff. Have you had your colonoscopy, your mammogram, your pap smear, if it's applicable, bone density, whatever. And, a lot of times it's already done by the GYN, and that's great. Because they're really good at recommending that and doing it. But, some patients don't have gynecologists or they've missed the last couple of years. So, it's good for us we always ask that question for that reason.
Nice. And why don't we just sail right into the pap smears?
Right. So pap smears, you should start getting pap smears when you're sexually active. Cervical cancer, which is what we're screening for, is a sexually transmitted disease in many ways because it's related to human papillomavirus. Now, we'll see less and less of this, hopefully, as time goes on, because now we're vaccinating for HPV.
Right.
But years ago, there was no vaccination, so there's a lot of women out there who have been exposed. So, you're not going to get cervical cancer. I think it'd be unheard of almost. There might be the rare event if you're not sexually active. And honestly, to do a pap on someone who's not sexually active is going to be incredibly painful. So we don't recommend it with anyone unless, they're sexually active and they have potential exposure to HPV. And then I think it should be every year.
Okay.
And that's, and then there's a thought that as you get older, you can, go to every 2 years or maybe even every 3. And if you've had a number of normal pap smears, I think that's very reasonable. This test you can stop at a younger age. Okay. If you've had, year after year normal paps and now you're 65 years old or 70, you don't have to continue.
Nice. Okay.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
So you mentioned briefly HPV. Can we just have a little informative minute on that?
Right. So the HPV, human papillomavirus, it causes warts, but there's a number of strains. There's strains that cause common warts on your hand. There's ones that cause genital warts. There's some that cause cervical cancer. And basically, depending on the strain you get, you're at risk for a different condition or a number of conditions. And, cervical cancer can be really devastating. And that's what we're trying to prevent, basically, that with the vaccine that's available.
Yeah.
And we're trying to prevent, genital warts and the like. But pap smears, are another line of defense, and they allow us to catch early changes in the cervix from the virus. Mm-hmm. And we can catch not only cervical cancer, but precursors to cervical cancer from viral function in the tissue in the cervix.
Nice. All right, great. Bone density.
So bone density, osteoporosis is a common cause of morbidity and mortality in older folks. And what I mean by that is, you can have a hip fracture or spinal compression fracture. and have really serious complications from it. Now, many patients will die from hip fractures over the next few years, or just never really be themselves. They'll never reach the same level of functionality. And then spinal compression fractures, most of the time you're not going to die from it, but you can have ongoing terrible pain that can occur. So it's certainly not something that is not important. So this can be prevented if we treat osteoporosis, and we have a number of really good treatments, some oral, some injectable. But the first thing you need to do is diagnose the condition. So we have normal bone density, it's a spectrum. And then we have osteopenia, which is a lesser degree of bone loss, and then frank osteoporosis, where your bones are really thin and you're really high risk for fracture. So, we tend to test patients when they're postmenopausal. It's that loss of estrogen that causes the loss of bone. Men can get osteoporosis too as they lose testosterone, but we mostly think about women getting bone density testing, just because most of the fractures, that we see are related to postmenopausal osteoporosis. Although I will tell you, I've seen a lot of men with hip fractures too. So it's something to consider in an at-risk man. But we're talking predominantly, and a lot of this has to do with insurance coverage and that too, postmenopausal women.
What's a bone marrow test like? I've never had one.
Bone density?
Yes, I'm sorry. Yeah. I was thinking.
Okay, no problem. So, it's kind of like getting an X-ray. It's really, there's no real discomfort to it. It's, you basically get some pictures taken, and with that, we're able to tell how dense or thick the bones are, how much bone loss there is. We look at the hip, we look at the spine. And then you can get a sense of what the risk of fracture is down the road. And they'll actually put in the report 10%, risk, 20, 30% risk over so many years. So you have a general sense, and you'll have a sense of, where you compare to your other persons of your age. So know if you're, have more bone loss or what would be expected, etc. Now, everyone really should be on vitamin D, especially in New England. I think we're all vitamin D deficient. Vitamin D deficiency is very much associated with bone loss. I take vitamin D myself. I think it's a smart thing to do. I guess if you do know your vitamin D level is normal, I guess you don't need to, but most of us in New England are vitamin D deficient, especially now that we're all putting sunscreen on and all that too.
Yes, we're all living like vampires.
There's a lot of vitamin D deficiency out there, which is associated with osteoporosis and bone loss.
What's the most common dose that you see recommended?
So I used to give everyone 1,000 milligrams, or units, excuse me. And then I noticed that no one's vitamin D came up to a normal level. Then I started going to 2,000, and you'll get some that will go to a normal level with that. But I'm giving many patients now even 5,000 units, and then there's this 50,000 unit dose that you can do, weekly, and kind of load them up with. So there's a lot of different dosing schemes that are available out there, but a lot of patients are probably underdosed if they're taking 1,000. I'm not saying it's wrong to give 1,000, but you got to check levels, and if you find they're not going up, then you need to pump it up a little bit.
So when you have a bone density test and it's low, how often do you go back to get another bone density test?
Every few years.
And can you be like normal and then be like, oh my God, you're so bad?
Yeah, that's rare. I mean, it's a progressive thing that happens usually over a period of time. And you'll have the occasional patient that, has a massive drop in their bone density, but usually those are patients that have other risk factors. They're on prednisone, for example, or, there are other medications that can really produce pretty significant bone loss rapidly. But for the most part, postmenopausal bone loss is not going to happen overnight.
Remember that old ad, drink milk for your bones?
Yeah.
Make stronger bones.
Yeah.
What can we do to make sure we're taking care of our bones? Is there anything?
Don't smoke.
Oh,
okay. So tobacco is an issue. Basically, exercise, weight-bearing exercise is important.
Yeah.
Vitamin D is important. I gotta be honest, if someone has a balanced diet, I'm not a big proponent of calcium supplementation.
Yeah.
I'm not sure it's really necessary. I mean, unless you're on a very restrictive diet where you're not getting enough calcium, you probably don't need to take calcium supplementation.
Like gastric bypass.
Yeah. I mean, there are some patients who have unusual diets or they don't absorb. That's fine. But I think vitamin D is more important in my mind than calcium.
You know, it always comes back with a lot of health topics that it's you diet and your exercise.
Yeah.
And probably sleep too. But we know it's a full circle, that we say.
I mean, I think you're right. I mean, a lot of, for preventative purposes, diet and exercise are probably the two most important things that you can really do.
Yeah.
Healthy diet, you know, reasonable caloric intake, daily exercise.
Nice. Prostate. Do you want to talk about prostate screening?
Sure. So, you know, prostate screening, we have a great lab test. It's not perfect, but it's the PSA, the prostate-specific antigen. And basically, there's a normal level, and it goes up to 4. And what we're looking for is levels that are higher than 4, or someone has really jumped up rapidly. So they were 1.5 one year, now they've gone up a whole point in a year. We do this testing every year. If they went from 1.5 to 2.5, well, that would be a concern, and you'd worry that there's something going on. We test everyone 50 years of age or older, and like a lot of these testing scenarios, if there's a first-degree family relative, a brother or sister, or in the case of, it would be a sister in prostate cancer, but I'm just talking in generalities, colon cancer included. If they have a, you know, a first-degree relative, which is a mom, dad, brother, sister, who had one of these conditions at a younger age, you want to test earlier, but for all comers otherwise, for PSA, 50 is reasonable.
Okay. All right. Anything you want to add before we
No, the only thing I'll add to PSA is that, you know, there's a point where you should stop, too. You know, you don't do PSAs on 90-year-olds because, you know, a lot of men are going to get some element or some component of prostate cancer as they get older, and it doesn't mean they're going to die from it. It's different if someone gets prostate cancer at 50 than someone who gets prostate cancer at 90.
Right.
If I get prostate cancer at 90, I'm probably not going to treat it. I'm probably not going to die of it. If I get it at 50, I have a lot of years ahead of me, and that becomes an issue.
Okay. Perfect. Thank you.
You're welcome. So thank you, everyone, for listening to our show. And if you'd like to become a sponsor, contact us at 617-775-3737. And special thanks to Primacare, your trusted medical providers in southeastern New England, and BioSkills of Northeast for producing our show. And they're not producing this show, but that's okay. We want to give them credit because they do such a great job.
We gave them a break for the month of August. We're doing homegrown videos.
We gave them a little break.
The Ask Me Doc series.
And they are available to produce your show by calling 774-301-8811. They do a really fabulous job. And if you've watched our other shows, you'll see the quality that's there.
Yeah.
Bay Coast Bank, just right for all your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. And Duncan Hearing Healthcare you can trust, with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. Thanks again, and we'll see you soon.
Bye.